Hello everyone, OT Life Hacker back with acute care lab values on kidney function. So if you guys have seen my other videos, you know about the blood values and the electrolytes. Videos will be available in the description box below if you haven't seen them yet and you're like, oh, what's that? Well, check out the description box. Thank you guys for joining me and thank you guys for all of your love. I get to see that these videos are helping you guys out so much because I appreciate so much the new subscribers, the likes, the shares, and the messages that I've been getting from you guys. I'm so glad it is helping. The very reason that we made the video. Oh my gosh, this is wonderful to hear. So thank you guys. If you are brand new and you're like, what's this all about for the lab values and why do we need to know this in acute care? If you are going into field work or starting off fresh in acute care as a brand new therapist, congratulations. It is going to be very important to know your lab values because in acute care you're working with patients who have some sort of acute need, some sort of instability potentially going on within their body, and so that can be reflected in their lab values. And today is going to be kidney function. So again, if you are going to use these resources, guys, that I will be putting in the description box below, please do the links for them. Please do let me know, write in the comments, or please do subscribe, like, share. These resources are completely free. It helps me out so much. Of course, if you could like, subscribe, and share. So thank you guys very much. Let's get started. Kidney function. The serum creatinine is a waste product that comes from the normal wear and tear on the muscles of the body. And the normal for males is 0.7 to 1.3 milligrams per deciliter. Females, 0.4 to 1.1. Now, if it trends higher than their normals, the causes could be, and some things to look for, if your patient, for example, is in for renal disease, or they have muscular dystrophy, or rhabdomyolysis, or dehydration, maybe that was one of the reasons they're in. Always important if you see, oh, they have renal disease, maybe I need to take a look at their kidney function. The kidney lab values, because if there's some sort of instability or abnormality in their lab values, you will need to be aware of that for safety risk in the session. So, some symptoms to look out for high is reduced urine output, dark color urine, edema, such as swelling of the extremities, back pain, fatigue, low fever, loss of appetite, they don't want to eat, they're confused, dyspnea, difficulty breathing or labored breathing, headaches, some implications for therapy, and of course, safety concerns is they may have decreased activity tolerance. If they are highly off of the normal, you may want to check with your team, consult, see if it's okay to see them, and if not, you may need to hold off on therapy. So I emphasize this as well, very much team-oriented approach, guys. Make sure you consult with the team. If someone has seen them earlier, then ask them, hey, how did they do during the session? And then check with the nurses. Is it okay to see them if they're if the creatine is this high? What do you think? So make sure you're checking up. And then for low, there we go, so you can see it all. For low, some causes can be pregnancy, age, low muscle mass, liver disease, low protein diet. Symptoms, the biggest is fatigue. And then the second thing for the kidney function to look at is the blood urea nitrogen. So this comes from the breakdown of the proteins that you eat. And a normal level is between 7 and 20. As kidney function decreases, the levels will rise. So I have looked at multiple resources, which I've mentioned in my other videos. So you'll see here that there's also, I wanted to particularly point this out for you guys, that you'll see there's multiple resources out there and they're all kind of, not all, but you'll see some slight variations, or at least I did when I was looking at them. I'm like, which one is right? But then you can ask your hospital what levels they go based on, but for the most part they're fairly in a similar range. The extremes are what you want to be careful of. So for increases, the causes could be high protein diet, renal failure, decreasing volume, congestive heart failure, gastrointestinal bleed, fever, increased protein, again, same as the high protein diet, catabolism. So that's the breakdown of molecules into energy. And symptoms: hypertension, fluid retention, fatigue, poor appetite, itchy, dry skin, decreased cognition, dyspnea, and bone pain. And implications: also decreased activity tolerance. And of course, you want to make sure that you check with your team. What did I say, guys? Exactly. Make sure you check with the team. See if it's okay to see them. And remember, if you do see them, you want to be on the lookout for these symptoms. If you see any symptoms appearing, you have to make sure you monitor and act appropriately. So that's what I also want to emphasize. We look at symptoms because when you're seeing the patient and there's like some slight abnormalities or very high abnormalities, not too high where it's not safe to see the patient, right? You want to be careful. If they're having any symptoms or sudden changes, then you're like, oh, okay, we need to take a step back and we might need to rest, reevaluate what we're doing, check with the team, see what's going on, because they might be having these symptoms and it might be due to changes in kidney function. And then low, I didn't find too much for low. So for low, the causes can be hepatic disease, malnutrition, and the symptoms said uncommon. So I will also be putting the resources that I used in the description box below so that you guys can reference them as well if you would like. And of course, I gotta give a shout out to where I get the resources from, right? So make sure you check those out. Now, the GFR. So this test is a measure of how well the kidneys are removing waste and excess fluid from the blood. Now, the glomerular filtration rate is calculated from the serum creatinine level using age and gender. And the normal can vary based on age. As we said, it matters with age. And a normal level is 90 or above. A level below 60 can be that the kidneys aren't working very well. And again, you gotta look for those signs and symptoms. And if it goes below 15, well, you know what to do here. So it says the person can be at risk for needing treatment for kidney failure, such as dialysis or kidney transplant. And then this is also something that I made note of, that for kidney function, same as you were saying, if it's below 60, right? Below 60 here, could indicate kidney disease. The urine albumin to the creatinine ratio of more than 30 milligrams per gram could be a warning sign of kidney disease. So this is just telling you that you really do need to look out if the glomerular filtration rate is less than 60. That's a big, you gotta be on the lookout. All right, so guys, I hope you like this video. Again, you'll find this sheet for these values in the description box below. If you want to take a look at the other values that we have here for the electrolytes and for the CBC, the blood count, then check out those other videos and make sure if you're using these resources, please do subscribe, like, share, and do feel free to comment or find me on Instagram to let me know how these are helping you, because the reason I made these is to be able to help others. When I was going into acute care, I freaked out. I totally freaked out because I'm like, I don't know what I'm supposed to be preparing. I tried to find resources. Fortunately, there's more out there now, but when I was looking, that was a no-go. So I truly hope that this can help you guys out, and feel free to find me on Instagram at ot_lifehacker, and see you guys all later. You will be finding more on acute care and more on my other adventures in pediatrics. For those of you who are going to pediatrics for field work, be on the lookout. There's more to come for peds. Woohoo! So I will talk to you guys all later. Bye bye. OT Lifehacker out.